This past Thursday, Iowa Governor Terry Branstad signed into law a major expansion of state-sponsored health care for the Hawkeye State. However, a small provision was buried inside the huge bill in regards to state-funded abortions through the Medicaid program for low-income individuals. The provision gives Branstad the last say on whether the state will approve reimbursement of certain abortions, specifically those as a result of rape, incest, fetal abnormality, or to save the life of the mother. As it turns out, Medicaid reimburses very few abortions in Iowa each year for the aforementioned reasons. For fiscal year 2012, there were only 22 abortions, and for 2013, there were 9 that were Medicaid reimbursed, or taxpayer funded, as many politicians enjoy saying. Branstad's new despotic abortion powers were an integral part in not only passing this legislation, but also towards the Iowa Republican quest to cut out all possibility of taxpayer-funded abortions. Currently, the Department of Human Services has a review process in place for Medicaid reimbursing abortions after the procedure. With the new bill signed into law, the existing process will likely continue, but with the new twist of Branstad having veto powers over whether Medicaid should reimburse the women. Now, understand that Branstad is not a doctor or health professional in any capacity, but is instead a lawyer and, of course, a politician. However, he will be deciding whether certain abortions should be reimbursed versus a Medicaid doctor making that decision. This bizarre, nonsensical, and disturbing new framework was formerly unheard of in this country. Regardless of the small number of abortions that fall under this provision, these low-income women are being targeted simply because they qualify for Medicaid reimbursement. Iowan Republican politicians appear so hell-bent on erasing taxpayer-reimbursed abortions because of their idiotic religious beliefs that they will potentially deny abortion reimbursement to women who cannot afford the procedure. Even if Branstad denies any of these cases in the future, it is highly unlikely that the women will be able to pay the bill, leaving the hospitals to eat the cost. Looks like a losing proposition to me.